Today, I'm taking a look at some of the top health headlines affecting our state and what our community is doing to raise awareness. I'm Brena Kamal. Our Issues Twin Cities starts now. Family Tree Clinic in St. Paul, patients are provided with reproductive and sexual health services.
We specialize in sex-positive sexual health care and education, and a lot of the calls that we get each day are from people who have concerns about their sexual health, whether it's related to pregnancy prevention or sexually transmitted infections or needing a PAP or a breast exam. That's really that's mostly what we do.
What do you do here at the Family Tree Clinic to keep our community educated, safe, and healthy?
A lot of what we do is about education, providing information for people to be able to make really informed decisions about their sexual health and their sexual practices. We provide really low-cost medications and testing and all sorts of health care.
Recently, the number of reported STD cases in Minnesota have gone up in the last few years. Chrissy is the STD section manager at the Minnesota Department of Health. Why have we had a significant rise in the number of STD cases recently?
It can actually be attributed to a few different things. One would be clearly people are still having unprotected sex, not getting tested, not getting treated. They don't have symptoms sometimes for some STDs, so when people don't have symptoms for something, they don't go in to seek health care. So when you don't get tested, you don't get treated, and therefore you're still transmitting the disease to others.
Chlamydia continues to be the most common STD, followed by gonorrhea and syphilis. How are STDs a serious health threat?
STDs are a serious health threat for many different reasons. For chlamydia and gonorrhea, they can lead to infertility in men and women, and they can also be transmitted from woman to child. So if you're not tested when you're pregnant, you can give that disease to your child, which can cause premature labor. They can even have infant pneumonia or blindness in the infants as well. For syphilis, it can affect an individual by causing dementia. It can cause death even sometimes, blindness in an individual that has syphilis and it isn't treated. And the biggest thing with chlamydia, gonorrhea, and syphilis, if you're tested and treated, you're cured. So it's a little different than HIV, where HIV is turned into more of a chronic disease. It's a manageable disease, but with those other ones, you can be tested, treated, and cured.
For many people, when they can't access testing or treatment for sexually transmitted infections, they can turn into kind of bigger health concerns than they would have been if a person had been tested early and treated early on. They can kind of cause more, harmful effects to your body if they're not found early and treated. So in that way, they can be serious to a person's health. There are some infections that really don't cause any long-term health effects. They're not really damaging to your body. So it really kind of just depends. There's a lot of stigma around STDs, and so for some people that can be kind of the most harmful thing for them.
Who's more at risk, men or women?
It depends on the disease, actually. So chlamydia last year in 2014 had about 19,900 cases, close to, and of those, the highest number of people that were at risk were teens and young adults between 15 and 24, a majority of women. Also blacks. Minneapolis had the highest incidence of chlamydia, but the difference in chlamydia with the other diseases is it does affect the whole state. A third of the chlamydia cases are actually outside of the metro and suburban area. Every single county in Minnesota has a case of chlamydia. Gonorrhea had over 4,000 cases in 2014, which was an increase from the previous year as well. More males than females, just slightly. 51% males compared to 49% females, but that's actually interesting because this was the first year in a long time that men actually had more cases of gonorrhea than women, and that also affects age range 15 to 24 as well, and also the highest among blacks.
Okay.
And gonorrhea is more concentrated in the metro area, almost 80% is in the metro and suburban areas.
The health department recently reported racial disparities in the infection cases. Chlamydia rates were 10 times higher for African Americans than Caucasians, 4 times higher for American Indians, 3 times higher for Latinos, and twice as high for Asians. Why are chlamydia rates higher in some communities rather than others?
Disparities in STDs really can be contributed to many different things and lots of social determinants of health, and it actually affects not only STDs but other things that the health department looks at for like health outcomes. But there tends to be a lack of insurance coverage. There could be lack of access to care, so they're not seeking preventative treatments, getting tested or treated because they don't have the access to the health care. Also employment. Some may not have the employment opportunities that others do as well. So it really comes back to those social determinants of health.
What are health professionals most concerned about?
We're really still concerned about, with, like I said, with chlamydia and gonorrhea, the lack of symptoms. So a lot of times you don't see the symptoms. So 3 out of 4 women don't have symptoms and 1 out of 2 men don't have symptoms. So when you don't have symptoms, you're not going in to get tested. Therefore, you're continuously spreading the disease. If you're not getting tested and treated, which is our most important message we're going to give anybody, is that you need to get tested. So if you're sexually active regularly, you're really going to want to go in and get tested.
As health professionals, what are you guys doing to tackle this issue?
One of the first things we do is partner services. We have disease investigators that go out and talk to people that have been reported positive to the health department. And what they'll do is they'll go solicit partners from the individual that's infected to go out and let them know that they may have been exposed to a certain disease. So if you had somebody that had syphilis and you went out to get their partners, you would let them know that they should go in and get tested because they've been exposed to that.
And for anyone who is interested in getting tested or treated for an STD, the Family Tree Clinic provides various services.
We have patient educators that people can meet with to get tested. We also have some really wonderful nurse practitioners, nurse midwives, who can also meet with people to get tested and treated. So if a person calls, a lot of times we get calls from people who just want to get tested. Maybe they have a new partner or they're thinking about becoming sexually active and they want to get tested and just know their status. For a lot of people, that's why they're calling, just to know their status and be able to share that. So in that case, we can have them meet with somebody, get tested. That usually requires like a blood draw, a urine test. We also have people who call us and are having some symptoms, or maybe they've had a partner who lets them know that they have an STD and so they want to get tested to find out what their status is in that way.
Coming up on Our Issues Twin Cities, why skin cancer rates are dramatically on the rise in Minnesota. One of the most deadly forms of skin cancer is on the rise in Minnesota.
Melanoma is skin cancer, and it's one of the 3 most common skin cancers, and it is the most deadly of the 3.
Michelle is the policy coordinator at the Minnesota Department of Health's Comprehensive Cancer Control Program. What are the risk factors when it comes to melanoma?
The risk factors are being fair-skinned, having green, blue eyes, light-colored hair, lots of moles. Any of these are individually risk factors. Having a lot of moles, and also we know that exposure to ultraviolet light, especially excessive sunburn to children and youth, is a risk factor for later melanoma. In addition, indoor tanning is a risk factor for melanoma.
Which particular age groups have the highest rates of melanoma?
Men over 60 years of age have the highest rates of melanoma. Melanoma can happen in young people also, and we're seeing increasing rates of melanoma in young people. In the last 5 years, we've seen increases of 4% of new cases of melanoma in young women ages 20 to 49 years old.
Devastating, both emotionally and physically. It was just a really tough time.
A 5-time malignant melanoma survivor, Kim was first diagnosed with melanoma when she was 20.
When did you first suspect that you had melanoma?
To be honest, I never really suspected. I had had a freckle on my left cheek removed 10 times, mostly for vain cosmetic reasons. So I really didn't suspect that I had melanoma until the 10th time it was removed and I got my first diagnosis.
Kim's skin cancer is genetic. Both her grandmother and 2 uncles battled melanoma.
I have lost my grandma and 2 of my uncles to it. I have what's called familial or genetic melanoma. So I've also had some gene testing done to confirm that. So that makes it a little bit tougher. Genetic melanoma only accounts for about 10% of melanomas. I actually had my P16 gene tested, as I mentioned before, and so I stay out of the sun because it's still really important, but my own worst enemy is my personal history and that mutated gene. It means that I'm also more susceptible to both pancreatic and breast cancer.
How has that affected you throughout your life?
A lot. You have to wear your sunscreen all the time. It's difficult to get through every 6 months because that anxiety level is just skyrocketed because you never know if you're gonna get it again. So it's changed my life pretty dramatically, but I still feel really lucky.
Melanoma has doubled over the past 3 decades in the United States. Rates have gone up 250% among young people, especially women.
Why have we seen a large increase in melanoma rates across the country and particularly here in Minnesota?
There is an increase in the rate of melanoma across the country. And in Minnesota and 2 of our neighboring states, we have seen increases in the last 5 years. Melanoma rates have increased 30%. So that's a very large increase in the number of new cases of melanoma when most cancers, like colorectal cancer and lung cancer, are actually decreasing. We're seeing increasing rates of melanoma.
So mention that it's very concerning.
It's concerning because we believe it's preventable for most cases. And that's where we want to get the word out that there are things that people should be doing both for themselves, for their children, to prevent melanoma.
Since Kim's first melanoma diagnosis, she has gone through hundreds of biopsies and 3 more melanoma diagnoses.
How have you remained strong and diligent throughout the years?
Like I mentioned, it's really hard for those checkups. For many years, they were every 3 months, so your anxiety level never really had a chance to come back down before it went back up. But I'm so fortunate to have an amazing support structure with my friends and my husband. He makes me diligent.
As a volunteer, you have partnered with the nonprofit Melanoma Awareness. Can you talk about that organization?
Keith Kamen, his legacy is why it was started. His parents actually started Melanoma Awareness back in 2005 when he lost his battle to cancer. My husband Paul and I joined the organization in 2008 and have now kind of taken over the leadership of that nonprofit. It's been really exciting and we have some really great volunteers. We're always looking for more volunteers if anyone's interested, but it really is a passion of ours. We've all been touched by melanoma in some way and we want to go and tell as many people about it as we possibly can. I think it's one of the main reasons that I feel like I've survived 5 rounds of melanoma. It's everything to me. We have to get the word out.
Up next on Our Issues Twin Cities, the #1 cause of melanoma.
I really didn't understand that a young person could be diagnosed with skin cancer and that it could be deadly as well.
Like many women, young and old, Megan grew up laying in the sun and using tanning beds. At just 20 years old, she was diagnosed with stage 3 melanoma.
Did you ever suspect anything was wrong?
I have lots of little moles, freckles that are light brown. They all look similar to each other, but I had a new mole that had shown up on my skin that was drastically different looking. It was darker, it was elevated, but something that really gave me a gut feeling that something was wrong with this spot was that it would itch and it would bleed, and it would kind of continuously do that. It would never heal, it would never go away. It was just something that kept persisting, and it just kind of bothered me. It was on a spot on my lower back on the right side, so it would rub on the inside of like my pant leg. And so it would just kind of do that a lot, and I just thought that was super weird. So I did go get it checked out by a doctor, maybe a few months after I had noticed the mole. And the first doctor actually, unfortunately, had told me that he didn't really think it was anything to be concerned about, and so he had given me the advice just to keep watching it for a few more months, and hopefully, if it would go away. But I just kind of got that gut feeling still the whole time that something was really wrong, and so I went into my regular doctor in May and had it taken off, and it was diagnosed at stage 3 melanoma right out of the gate.
Over 90% of melanoma cases are caused by overexposure to tanning beds and UV radiation from the sun.
Research shows that women who tan in an indoor tanning booth under the age of 35 are at a 59% greater risk for melanoma than women who don't tan indoors. That's a very concerning statistic. And so we're encouraging people to not tan indoors.
Were you an avid sun tanner?
Growing up in Minnesota with the light hair, light skin, light eyes, we had a pool growing up. I had my fair share of sunburns, definitely. I wasn't always the greatest about my sunscreen when I was younger, but when I got into high school, I realized that tanning beds were a way for me that I actually could get tan. I used to lay out, and really I could never lay out and get a tan. I'd always just burn because of my skin, and so the beds bulbs have the UV bulbs taken out, so a lot of times you don't get a lot of the burns associated with tanning beds, and I had been told the myth that you could gradually build a tan and it was the safe way to tan, and so I actually could achieve a tan that way, so I started using tanning beds throughout high school and college. The largest users of tanning booth are young college females, white college females, and then also we're seeing a very large percentage of white high school students. We did a survey in Minnesota of high school students, and we found that 34% of 11th grade white females tanned indoors within the past year.
According to a report by the Center of Disease and Control, higher melanoma rates occur among women aged 15 to 49, probably because young women are more likely to indoor tan.
So many people use tanning booths, so many people suntan. Looking back, did you ever think that this could happen to you?
I didn't, no. I was young, naive. I kind of had, understood that, there was certain myths involved with tanning and stuff that I held to be true. So things like that, weren't as readily education-wise available to me. And so I really didn't understand much about skin cancer, and knowing that it could happen to someone so young, and knowing that it could happen to anybody at any time, regardless of your age, gender, race.
Now that you've gone through this experience like we're talking about, how dangerous is it to overexpose yourself to the sun or tanning booths?
It's very dangerous. I always tell people, if I can teach people about sun safety and teach people about, the dangers of tanning beds have been labeled by the FDA as a class 1 carcinogen. So just as we know cigarettes are highly linked to lung cancers, oral cancers, tanning beds are linked to skin cancers, all of the 3 types of skin cancers, specifically melanoma. So it's just very, very important that you avoid tanning beds, kind of just understand that they're dangerous, not worth using in any amount. I even was the person who didn't use it in my mind as frequently as some other people that I knew, and I still got melanoma. So you're never going to know if you're going to be that person. So, avoiding those altogether is smart.
In August 2014, a new law went into effect in Minnesota concerning UV light tanning devices, prohibiting people under the age of 18 from using UV light devices.
Before the new law, if you were 16 years old in Minnesota, you could get a driver's license, you could get a job, and you could go tan indoors. And after the law went into effect, now people under 18 cannot tan indoors at an indoor tanning facility. And so it does not matter, there's no exception for parental permission, there's no exception for physician order, you cannot tan at an indoor tanning salon if you're under 18.
How important is this law, especially today?
Super, super important, just because I think it's another way that we're educating people and just kind of having them see that, you know, before they make that choice, that, you know, this can and might and probably will happen to you. I've met so many people now that even if they don't get melanomas, they've had, you know, 20 to, you know, in the hundreds of biopsies done for basal cells and squamous cell carcinomas, those other types of skin cancer. So it's highly linked and it could be potentially fatal.
And unless we change our sun obsession ways, melanoma will continue to increase. Today, health officials are taking preventative steps to caution users from over-excessive UV and sun exposure.
The Minnesota Department of Health for the past 2 years has had a video competition for middle school and high school students, and it's called the U Video Challenge. It was really important to us to have youth develop messages about the dangers because they will listen to their peers. And so we wanted the youth to develop the messages, and they did some great, really creative, fun videos.
As a survivor, how do you raise awareness?
By being a part of melanoma awareness, a big piece of that is going out into our communities and, you know, really trying to explain to people that it isn't just skin cancer. It is a deadly disease. We just heard that Jimmy Carter was diagnosed with, you know, stage 4 melanoma. It spread to his liver and his brain. It's important that we get the message out to everybody at an early age to tell them, you gotta watch for change. If nobody takes anything away other than this, it's watch for change. We know our body's the best. If something changes, this is one of the few times in life that change is never good.
And especially be careful, try to avoid being out in the sun in the warmest part of the day from 10 a.m. to 2 p.m. If you have to be out in the sun during those times, again, be sure that you're protecting your skin.
Thank you for joining me this week on Our Issues Twin Cities. I'm Rana Kamal. See you next time.